Alright everybody, welcome back to another Gumroad video. This one is going to be on the anatomy of the leg and on the foot. So we're going to start out by taking a look at how we can create our own custom primitive forms, because it's going to be an invaluable technique as we study anatomy. I'm starting off by placing a random shape within a square. I'm then going to take that square, turn it in perspective, extrude that square out to create a rectangular prism, and then place that same shape on both opposite faces. From each vertex on this shape, we can expand out to the opposite face, thus extruding that shape. The square framework helps us place this in perspective and get a sense of where our left and right vanishing points are. We're going to use this technique a lot throughout the entirety of our process because when we add bones, muscles, and fat together, it creates these very organic and unique shapes. We can take these same custom shapes and bend them in perspective, but in order to do that, we need to understand how form changes as it's turned. One of the ways we can determine the orientation of an ellipse is based on its minor axis. When we create a plane standing straight up, oriented towards the left, the minor axis of this ellipse is heading back towards the right vanishing point. If we take that same plane and then push it forward along an elliptical path, we find that the tangent line of that elliptical path is roughly equivalent to the minor axis of the ellipse at that point. So in this instance, the tangent line of the elliptical path is also heading in the direction of the right vanishing point. And the same thing is true for the plane that is lying flat on the ground. In this instance, the tangent line of the elliptical path is straight up and down. Thus, the minor axis of that ellipse is going to be a vertical. So we can take this same exact trend and apply that to the primitive form that we created before. Technically speaking, these aren't actually minor axes because they're not cutting along the shortest path of the polygon. So as I mentioned, we can use the same exact technique when representing anatomical figures, and this will help us orient ourselves when we're drawing these things. So here I'm creating a similar shape that's going to be representative of the leg. And now as it turns towards that lower leg, the minor axis is shifting its orientation. And again, I'm using that term minor axis rather loosely. It's not actually a minor axis because it's not intersecting along the smallest path, but it's more of a indicator of its tilt. All of these cut lines here are going to be leading back towards that right vanishing point. And just make sure all of those lines are converging. Using this same principle to draw in a foot. I create a lot of cross sections, which allows me to understand what's happening on the far side that's not visible normally. Imagine it as an X-ray view of your subject. And again, these lines are going back towards the left vanishing point here. So let's begin studying the anatomy by taking a look at the underlying bony structures. Here I'm starting with the ala of the hip. Then emerging from the hip socket is the femur. Covering the junction between the upper leg and the lower leg is the patella. The lower leg consists of the tibia and the much smaller fibula. We'll discuss the foot bones in just a little bit. Try to familiarize yourself with these shapes, but we'll use some more simplified forms later on in the video. The head and neck of the femur fit directly into the socket, which is known as the acetabulum. We'll take a look at this from a back view. The hip is a pretty complicated structure, so make sure you spend some time familiarizing yourself with the forms. Here's the neck of the femur. The greater trochanter is that pointy prominence that sticks on the lateral side of the femur. You can actually see that from the surface anatomy. It sort of pokes through the skin there. Notice that the fibula is on the lateral side, and it actually ends a bit lower than the tibia does. Once again, I'm pointing out that greater trochanter there on the femur, and then on the medial side is the lesser trochanter. The two cylindrical shapes at the base of the femur are known as the lateral and medial epicondyles, and it forms the junction of the knee. The ankle joint is formed by the junction of the medial and lateral malleus with the talus bone in the foot. Now let's have a look at these structures in a three-quarter perspective view. Here I'm just indicating the shape of the ala, or the wing, of the hip bone. There's the acetabulum, the neck of the femur sticking out. Now I'm drawing in the length of the femur, the lateral and medial epicondyles, and the patella. Now here I'm drawing in the tibia and the fibula, which sort of sits underneath the head of the tibia. Now I'm drawing in those forms for the malleus. Here I'm adding in some hatching to indicate the turning of the forms, making sure to indicate that 1, 2, and 3 side of each form, and then adding in a thicker line weight to indicate that the ilium is overlapping or in front of the sacrum. Going back to the minor axis as a tool to understand the orientation of an ellipse or cylinder, we can use the minor axis to figure out the position of our bones in three-dimensional space. Later on in the video, we'll be simplifying these bones to simple cylinders, so understanding this principle will be crucial. Let's take a closer look at the knee and ankle joints. I can use the degree and minor axis of each of those circular elements to get a better understanding of the form in 3 dimensions. Notice that the degree on that lateral epicondyle is very circular because it's in our direction. When a circular element turns away from you, the degree becomes much more shallow and flat. I can draw some axial cross sections going through this to better understand the 3-dimensional form. I can use the minor axis created by the cylindrical elements of the epicondyles to figure out my perspective. Remember that each element in a drawing helps to contribute to the overall perception of perspective and the shaft of these bones, which runs vertically, also has a vertical minor axis. We'll take a look at this from a back view. What you can see is that those epicondyles are actually tilted at slightly different angles to one another. And they fit directly into the top of the tibia. And there the fibula lies directly underneath the head of the tibia. I'll once again place in those cross sections just so we can get an idea of the structure. And I'll place in those minor axes. Once again, the shaft has a vertical minor axis. All right, let's take a closer look at the ankle joint. Here I'm just indicating the cross sections of the fibula and the tibia. Once again, the fibula is on the lateral side, and it ends at a lower point than the tibia does. The combination of the fibula and the tibia come together to form a sort of socket for the talus bone, which is the first bone on the foot. I'm adding some axial cross sections again. Whenever you want to try to understand something in 3 dimensions, it's a good idea to add these cross sections because it takes it a step further from just drawing the 2-dimensional shapes that you're seeing. And here I'm just indicating that the vertical shafts of those bones each have that vertical minor axis. And the conjoining talus bone has a minor axis that's going in the perpendicular direction. Let's take a look at this same juncture from the opposite side. Again, we can see that the fibula is sitting on the lateral side and the tibia is on the medial side. The back of the talus slopes down in an extruded C curve, and then there's this little lip for the fibula to fit into. And here, this bone that forms the heel is known as the calcaneus. Just creating those cross sections again so we can see the far sides that wouldn't normally be visible. You can start this way too if you want to create your cross sections and then create a line that conjoins them for the silhouette. Now let's have a closer look at the bony structures of the foot. I start just by gesturing in some lines for the shape of the foot, and here I'm indicating the fibula. So we already discussed that the ankle joint is formed by the malleus, which is the junction of the tibia and the fibula. The bone they wrap around is called the talus, which sits directly on top of the calcaneus bone, which forms the heel. In addition to the already mentioned talus and calcaneus, there's another 5 tarsal bones, which are those square-shaped bones that are sitting in between the talus and the longer metatarsals. Unlike the rest of the metatarsals, the 4th and the 5th can join to one tarsal bone, known as the cuboid. The remaining bones that form the toes are known as the phalanges. With the exception of the big toe, each toe has 3 phalanges, known as the proximal, intermediate, and distal phalanx. If you're feeling pretty ambitious, you might want to further study each of these bones. The way you can do that is by using center lines with a series of perpendicular cross sections in order to build out form. If you read How to Draw by Scott Robertson, you've seen this technique and you should be pretty familiar with it. If not, just have a look and see the way I go through it. At various points along the center line, I'm creating cross sections that are going towards that right vanishing point, and then I create a line and a heavier line weight that connects each of these cross sections and creates the silhouette line. Now I'm just carrying each of those cross sections through. And this is a pretty similar sketching style to that you've seen in product sketching and industrial design. We can do the same thing from a back view, again to further our understanding of this bone and its three-dimensional structure. Eventually, as you start to feel a little more comfortable, you can do this in a direct drawing style where you don't need to use these center lines and cross sections. In my intro to dynamic sketching video, I discuss a lot of these techniques, and in the first part of this series, I covered duplicating curves in perspective. So if you're unfamiliar with any of these techniques, I highly suggest that you go back and watch those. Alright, now that I've drawn the talus from two different views, let's try the same thing with the calcaneus. Starting with that center line, drawing those perpendicular cross sections that are going back towards the right vanishing point. Connecting those back with a thicker line weight to form that silhouette. There's a bit of an inward extrusion on this left side, catching to indicate the turning of the form. A good way to wrap your mind around placing the foot in perspective is to simplify it to even more basic primitive forms. So I'll avoid doing any complex curvature or anything like that. Using really simple forms allows us to internalize the perspective a lot better because it's easy to visualize where the left and right vanishing points are going to be. So I'm starting off with this extruded pitchfork shape to indicate the ankle, and here a wedge for the talus. I'm going to extrude this strange seven-sided polygon for the calcaneus bone. Here I'm simplifying the metatarsals to just this curved rectangular prism, and this extruded half circle for the toes. Again, we can draw through to get a better understanding of how this sits in three-dimensional space and the width of everything. Alright, let's try this again, but now from a back view. I'm going to repeat all those same steps. Starting off with that extruded pitchfork shape, a wedge for the talus, here that sort of strange polygon for the calcaneus. Again, remember you can do custom shapes extruded in perspective. I talk about that in Intro to Dynamic Sketching. Now I'm going to draw through to demonstrate the full width of those. Let's talk about some of the movements that the foot can do. In my primitive breakdown, I've separated each of the components based on where they can articulate, which is going to be at the ankle joint and the junction between the metatarsals and the phalanges. So this first position, I've just drawn the foot in a resting pose. Here we're going to do what's known as plantar flexion, which is an elevation of the heel and happens as a result of contraction of the muscles on the backside of the leg. The opposite is known as dorsiflexion, which happens from a contraction of the muscles on the front of the leg. We'll take a look at those muscles in just a bit and see how their contraction can affect the movements of the foot. The structure of the toe is one that's characterized by the bony structure on the top and the fatty pads on the base. We can use those cylindrical shaped bony knuckles to sort of give us an idea of where the vanishing points are and to find our perspective. And looking at the toes in a top-down view, we can see that the big toe protrudes the most and it curves inwards in a C-shaped curve. If you're drawing the foot where the camera is positioned underneath it, it can be helpful to utilize the footprint. One way you can do this is by placing the shape of a footprint on a flat plane in perspective, and then extrude upwards to create volume. Alright, time to memorize names. This first big muscle here on the front of the leg is known as rectus femoris, which is surrounded by two muscles known as vastus lateralis and vastus medialis, on the lateral and medial side respectively. These are three of the four muscles that comprise the quadriceps, and they act to extend the leg. Wrapping in a spiral over the quadriceps is sartorius, which is the longest muscle in the body and acts to twist the thigh at the hip joint. The muscles in the pubic region are known as the adductor muscles, and those act to bring the leg closer to the center line and down to the ground. The muscles in blue are the abductors, and they do the exact opposite of those adductors. These muscles elevate the leg laterally and bring it away from the center line. The muscles on the front of the lower leg, in green, act to dorsiflex the foot, the main muscle there being tibialis anterior. In a back view, we can see the gluteus maximus and medius there on the hip. Those muscles connect to the iliotibial tract, which is a tendon that runs all along the side of the leg. Lying deep to the gluteal muscles and in yellow and orange are the biceps of the leg. Contraction of these muscles acts to bend the knee and bring the lower leg closer to the gluteal muscles. In this back view, we can also see gracilis, which is on the medial side and in purple, and the other adductors of the leg. All of those muscles act to bring the leg closer to the center line of the body and down to the ground plane. In sea green on the back view is gastrocnemius, which is the major muscle that helps contribute to plantar flexion. Its tendon connects at the calcaneus and is known as the calcaneal tendon, or the Achilles tendon. All of these quadriceps muscles are connecting at the hip and to the knee. The very long sartorius muscles connecting to the anterior superior iliac spine on the hip and the head of the tibia. All of these adductors are connected to the pubic bone and the femur. We'll take a closer look at each of these forms in just a moment, and we'll rely on some of those perspective techniques we were discussing earlier. As I write in the names of these muscles, try to familiarize yourself with their shape and their connection points. These abductor muscles connect on the crest of the ilium and to the top part of the femur, and they act to lift up the leg laterally. There we can see gastrocnemius poking through the back. Lying deep to that, but we can still see it from a front view, is the soleus. Here the aforementioned tibialis anterior, which acts to dorsiflex the foot. And fibularis longus. Here on the back view, we can see the iliotibial tract in pink, which is that very long tendon that connects from the hip all the way to the lateral epicondyle on the lower femur. We can see the gluteus medius and maximus from this side. The biceps femoris, semitendinosus and semimembranosus all insert in the hip and tuck underneath the gluteus maximus, and contraction of each of those muscles helps to lift the lower leg. Here I'm just indicating those adductor muscles, which we can see from both the front and back view, and the gastrocnemius, which is that main plantar flexor. Now let's take a little bit more of a structural approach to placing in these muscles on top of these bony structures. I'm starting with the pelvic girdle. I use a lot of simplified forms like cylinders and flat planes to get the perspective correct, and then I start adding in volumes and more curves. A little bit of hatching helps indicate where the form is turning. Always keep in mind where the minor axes are. See, I'm starting with those square forms and slowly just rounding them out to make them look more organic. Just again pointing out where those minor axes are. Here's the hip socket. I'm going to start with a sphere and then place a cylinder with a tilted minor axis. And now I'm placing in the femur. Again, simplifying it just to a cylinder. In this case, the leg is elevated and coming towards us. And here's the tibia. And the fibula. I'm going to point out a few landmarks here. The first one being the anterior superior iliac spine, which is this prominent point at the top, abbreviated ASIS, and the anterior inferior iliac spine, which is below it. The first muscle I'm going to place in is rectus femoris. It originates at that anterior inferior iliac spine that I just mentioned and inserts at the patella. It's sort of an extruded trapezoid shape with some twists and turns to it. Most of the quadriceps muscles are going to have a similar structure. This here is vastus medialis, which originates from the greater trochanter on the femur and inserts on the patella. Vastus medialis is coming from the lesser trochanter and inserts on the patella and is on the medial side, closest to the center line of the body. Here in blue is tensor fascia lata, which has a much more flatter trapezoidal shape, and it originates on the ischium and inserts on the greater trochanter of the femur. And continuing along the back of the ischium is gluteus medius. Originating from the pubis and inserting on the femur are the adductor muscles, which help bring the leg closer to the center line. Now we'll look at some of those muscles from the back view. Again, I'm starting by placing in the pelvic girdle. A little bit structural. I'm using those ellipses to figure out my perspective and my minor axis. I'm using a center line curve and perpendicular cross sections to get that complexity of the sacrum. And now I'm placing in the ilium, or the wing of the pelvic girdle. Minor axes, ellipses, and cross sections are all going to be crucial in figuring out these organic volumes. If you're really struggling figuring out how these shapes are placed in perspective, simplify them to very, very basic forms. You can just use a tapered cylinder for the pelvic girdle and cylinders for the femur and tibia. Now I'm going to place in that shape for the gluteus maximus. I'm following the contours of the ilium and the sacrum, and then it inserts on the back of the femur. Again, I'm using these extruded organic shapes to figure out how this perspective is going to be put in place. If you're struggling with any of this, spend some time just doing those exercises right in the beginning of the video. The biceps femoris is this muscle that's emerging from underneath the gluteus maximus. It originates from a bony structure called the ischial tuberosity on the pelvic bone and inserts on the top of the tibia. Everything just mentioned is the same for the following muscle, the semitendinosus, which is the more medial counterpart to the biceps femoris. Weaving itself underneath these two muscles is the gastrocnemius, which originates from the head of the femur and connects to the calcaneus via the calcaneal or Achilles tendon. Again, here in purple is that triangular shape created by the adductor muscles on the medial side of the leg. Those help bring the leg down towards the center line. And here is gluteus medius once again, and tensor fascia lata. And from this angle, we'd also see vastus lateralis of the quadriceps. All right, now that we've taken a look at the construction, let's give it a go with some poses and without as much construction underneath. I'm going to try a direct drawing style here where I'm just drawing in the surface anatomy, and then underneath I'll place in the bony structures. All right, everybody, that's it for this installment of the anatomy series. Next week, we'll be discussing arms. Once again, I'm really trying to take everybody's feedback into consideration, so if you have a moment, please just leave a comment on the associated YouTube video. That way I can figure out how to improve these Gumroad videos. I'm pretty new when it comes to doing this sort of long-form content, so I hope this helps a little bit. If you want access to all the Gumroads I make in 1 month, you can subscribe on Patreon for $5 a month rather than buying each video individually. Otherwise, you can just purchase the other videos on Gumroad. As of now, I'll be live streaming every Monday at 10 a.m. Pacific Time or 1 p.m. Eastern Standard Time, and that will be on youtube.com/moderndayjames. All right, guys, thank you so much. Take care, and I hope you guys enjoyed this video.